13 signs of hormonal imbalance in women. Hormonal imbalances in women are more common than many realize, and their impact on overall health can be significant. Imagine dealing with unexplained weight gain, persistent fatigue, or irregular periods without understanding why. For many women, these symptoms are just a part of life, often brushed off as minor inconveniences. However, what if these symptoms were trying to tell you something more? Hormones play a crucial role in regulating various bodily functions, and even minor fluctuations can lead to noticeable changes. In this video, we're going to explore 13 signs that could indicate a hormonal imbalance. Understanding these signs can help you take control of your health and seek the appropriate care. Let's delve into the subtle yet impactful ways your hormones might be out of balance. 1. Weight gain. Weight gain is often associated with diet and exercise. But did you know that hormones play a significant role in regulating your weight? Hormones like insulin, estrogen, and thyroid hormones determine how your body uses and stores energy. For example, hypothyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormone, can lead to a slow metabolism and subsequent weight gain. Additionally, women with polycystic ovary syndrome, PCOS, often experience insulin resistance, which can make it challenging to maintain a healthy weight. If you've noticed that you're gaining weight despite sticking to your usual diet and exercise routine, it might be time to consider a hormonal imbalance as a possible cause. 2. Irregular periods. For many women, their menstrual cycle is a reliable indicator of their overall health. However, when periods become irregular, arriving too early, too late, or not at all, it's often a sign that something is off balance hormonally. This is particularly true for younger women who aren't approaching menopause. Irregular periods can be a symptom of PCOS, where the ovaries produce excessive levels of androgens, leading to skipped or infrequent periods. It can also be a sign of thyroid issues or perimenopause, where estrogen levels fluctuate unpredictably. If you're experiencing irregular periods, it's important to consult the healthcare provider to identify the underlying cause and address it appropriately. 3. Heavy menstrual flow. Menstrual flow can vary from woman to woman, but a sudden increase in the heaviness of your periods could be a sign of hormonal imbalance. Excess estrogen can lead to the development of fibroids in the uterus, which are non-cancerous growths that can cause heavier than normal menstrual bleeding. If you find yourself changing pads or tampons more frequently than usual, or if your period lasts longer than 7 days, this could be a sign of an underlying issue that needs medical attention. Heavy menstrual bleeding can lead to anemia and other complications, so it's important not to ignore this symptom. 4. Sleep problems. Struggling to get a good night's sleep. Hormonal imbalances might be to blame. Progesterone, a hormone produced by the ovaries, helps promote restful sleep. When progesterone levels are low, it can be harder to fall and stay asleep. Additionally, low estrogen levels can lead to night sweats and hot flashes, which can further disrupt your sleep. Sleep is crucial for overall health, and persistent sleep problems can exacerbate other symptoms of hormonal imbalance, such as fatigue and irritability. If you're having trouble sleeping, it's worth discussing your symptoms with a healthcare provider to see if a hormonal imbalance could be the cause. 5. Persistent acne. Acne is often thought of as a teenage problem, but it can persist into adulthood, particularly for women with hormonal imbalances. High levels of androgens, male hormones that are present in both men and women, can cause the sebaceous glands in the skin to produce excess oil. This can lead to clogged pores and acne breakouts. Hormonal acne typically appears on the lower face, including the jawline and chin, and is often cystic, meaning it's deep, painful, and difficult to treat. If you're dealing with stubborn acne that doesn't respond to over-the-counter treatments, it could be a sign that your hormones are out of balance. 6. Digestive issues. You might not immediately connect your digestive problems to your hormones, but the two are closely linked. Fluctuating levels of estrogen and progesterone can affect the way your digestive system functions, leading to issues like bloating, diarrhea, and constipation. These symptoms often coincide with your menstrual cycle, which is a strong indicator that hormones are at play. Additionally, chronic stress, which increases the production of the hormone cortisol, can exacerbate digestive issues. If you notice a pattern between your menstrual cycle and your digestive symptoms, it might be worth exploring hormonal imbalance as a potential cause. 7. Chronic fatigue. Feeling tired all the time isn't normal, especially if you're getting enough sleep. Chronic fatigue can be a sign of hormonal imbalance, particularly if it's accompanied by other symptoms like weight gain, mood swings, or digestive issues. Low levels of thyroid hormones can slow down your metabolism, leaving you feeling sluggish and drained. Similarly, adrenal fatigue, which occurs when your adrenal glands are overworked due to chronic stress, can lead to a constant feeling of exhaustion. If you're experiencing unexplained fatigue, it's important to talk to a healthcare provider to rule out hormonal imbalances and other potential causes. 8. Polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is a common hormonal disorder that affects many women of reproductive age. It's characterized by the presence of small cysts on the ovaries and can lead to a wide range of symptoms, including irregular periods, excessive hair growth, acne, and weight gain. Women with PCOS often have higher levels of androgens, which can disrupt the normal balance of female hormones. If left untreated, PCOS can lead to serious health complications, including infertility, diabetes, and heart disease. Early diagnosis and management are key to minimizing the impact of this condition. 9. Mood swings. We all experience mood swings from time to time, but if your emotions are all over the place, it could be a sign of a hormonal imbalance. Hormones like estrogen and progesterone play a significant role in regulating mood. When these hormones are out of balance, it can lead to feelings of irritability, anxiety, or depression. These mood changes are often most noticeable during the menstrual cycle, pregnancy, or menopause when hormone levels fluctuate the most. If you're finding it difficult to manage your emotions, it might be time to consider whether a hormonal imbalance could be the cause. 10. Vaginal dryness. Vaginal dryness is a common symptom that many women experience as they approach menopause, but it can also be a sign of hormonal imbalance at any age. Low estrogen levels can reduce the natural lubrication in the vagina, leading to discomfort, itching, and pain during intercourse. This can have a significant impact on your quality of life and your relationships. If you're experiencing persistent vaginal dryness, it's important to talk to your healthcare provider. There are treatments available that can help restore moisture and improve your comfort. 11. Breast discharge. If you notice a milky discharge from your breasts and you're not breastfeeding, it could be a sign of a hormonal imbalance. This type of discharge is often caused by elevated levels of prolactin, a hormone that stimulates milk production. Elevated prolactin levels can be caused by a variety of factors, including thyroid disorders and pituitary gland tumors. While breast discharge can be alarming, it's important to seek medical evaluation to determine the underlying cause and receive appropriate treatment. 12. Hair loss. Hair loss can be distressing, especially when it seems to happen suddenly. While it's normal to lose some hair every day, excessive hair loss can be a sign of a hormonal imbalance. Low levels of estrogen and progesterone can lead to thinning hair and hair loss, particularly in women going through menopause. At the same time, high levels of androgens can cause hair follicles to shrink, leading to hair thinning on the scalp and increased hair growth on the face and body. If you're experiencing unexplained hair loss, it's important to consult with a healthcare provider to determine if your hormones could be to blame. 13. Cold hands and feet. Do you often find yourself feeling cold, even when others around you are comfortable? Cold hands and feet can be a sign of an underactive thyroid, a condition known as hypothyroidism. When your thyroid hormone levels are low, your metabolism slows down, which can lead to poor circulation and a constant feeling of coldness, especially in the extremities. This symptom is often accompanied by other signs of hypothyroidism, such as fatigue, weight gain, and dry skin. If you're frequently cold and can't seem to warm up, it might be time to have your thyroid levels checked. Hormonal imbalances can cause a wide range of symptoms that affect every aspect of your life, from weight gain and irregular periods to mood swings and hair loss. These signs are often dismissed or overlooked. However, understanding these symptoms and their connection to your hormones can empower you to take control of your health. If you recognize any of these signs in yourself, don't hesitate to seek help from a healthcare provider. With the right diagnosis and treatment, you can restore balance to your hormones and improve your overall well-being. If you found this video helpful, please like, share, and subscribe for more health and wellness tips. Remember, taking charge of your health is the first step towards feeling your best.